So moving on right now, Daktari, let's start with you. There is a question here for you here. Inasema, a 2-year-old who has a chronic constipation, barium enema X-ray was done and no Hirschsprung disease was visible, only an infection in brackets granular transverse colon, and that has affected hotria since it's not usual at the subject's age, but the doctor said nothing serious. It's because of his existing CP condition, but still doubt this. Please advise.
I think I think we better mention what is Hirschsprung. Hirschsprung is a disease that is inherited, a condition that is inherited. As the colon comes to end, as you approach the opening, the anus, there are nerves. And those are the nerves that will send the message to the brain that, you know, it's time to go and have a poo. Unfortunately, some of the babies, when they are born, that area does not have the nerves. And if you don't have the nerves, it kind of remains narrow. It doesn't open. And those kind of babies will definitely require surgery. And that's why the doctor did a barium enema. An enema is a test. It's like a material that is heavy. We put it rectally and do a picture, and it will tell us whether there's Hirschsprungs or not. But this baby seems to have other problems. There's something called CP, and CP, what they mean is actually cerebral palsy. And children with cerebral palsy, mnawajua ni wale watoto bana, mtoto anazaliwa vizuri sometimes, but sometimes they are born and they have a bit of a difficult delivery, and after that, they just don't grow the way you expect them. And mainly, when we say what it means to have cerebral palsy, means that you had a brain that was still immature, gets injured from anything. It could be trauma, you fall, or during birth, there is not enough oxygen. But this injury to the brain remains there, but the manifestations after that may vary. You may find either the baby will not be able to use one side of the body or one limb. So these variations, and they can actually vary with time. But we know that even those children also tend to have constipation, because again their muscles are not very, very strong, and because they're not moving, and again they may be more stationary and not very mobile. Some of the children, even if they have a desire to go and poo, what they do, they hold on it. And if you hold on it, this desire comes and tells you, go now, go now, go now. It may knock for about 20 minutes and nothing happens, and therefore it goes off. In these children, the CP, because of their delay in acquiring milestones, they have got to depend on somebody to possibly take them and have a poo. Or two, when they poo, they may just do a little and they stop there. So the poo remains behind. Luckily enough, if we find that this is a problem that is stayed there for about a year and all that, we now have medication that we use. One of them, if you ask many mothers who've been in hospitals, you find a baby with a tube in the nose. We put that tube through the nose and put it in the stomach and run this down. It's called Pegley, and many mothers may have heard about it. And when we use this medicine, it washes out all that, and this gives the baby a new start. And for children with CP, you can do that, say, twice a year or 3 times a year, because to them, to go to say now, Mama, I want to go, is difficult. So they have to depend on somebody saying it's time to go. But I think the dad should not continue to spend money trying to find out what is the cause of constipation. The constipation this baby has is related to the condition of cerebral palsy. And he needs to settle and just be able to work with the doctor. Can see a GIT person. What is a GIT person? People who deal with the stomach, the intestines, and they will help. But even if he's not in a place where he can see a GIT person, even a simple doctor, pediatrician, can actually handle this condition. Okay,
thank you very much. Then, Dr. Mutisya, there is someone here who wants to know the warning signs of mental illness, because you said you deal with mental illness. There is someone who wants to know the signs. How can you tell the signs?
Okay, first of all, to answer that question, I would like to first of all define what is mental health, what is good mental health, because some people do not know. People make jokes around and say that all of us have a degree of some madness. So it is important that we get to know that what is good mental health. So when we say that a person has good mental health, we don't just mean that they are not mentally ill. We mean that this person is able to cope with daily stressors. Like Daktari, when he was on the jam coming and he was getting late, that was a stress, so he's able to cope with that. So he actually has a good mental health. So if you are able to cope with daily stressors, again, are you able to realize your potential? If you are able to change the society in particular ways, to help the society in particular ways. If you have the capability of being a doctor, are you doing your work well? So are you able to realize what you're able to do? And again, are you able to contribute towards the society? So that is what we define as good mental health. Now, when it comes to mental illnesses, these are disorders affecting either behavior, thoughts, or even our emotions. Emotions like happiness. You find that this particular person who is probably having mental illness is not happy. Most of the time they are sad, and there's nothing particular you can pinpoint which is supposed to be making them sad. So those are disorders of emotions. Behavior, particularly the severe illnesses like schizophrenia. You will see they have disorganized behavior. Thought disorders, they will be having delusions. They think people want to poison them, even close family members, when they don't want to poison them. We also have the commonest, anxiety. Somebody worrying over everything, generalized anxiety. We also have phobias. People are scared of being in a lift, for example. We also have panic attacks, where some people are not even able to go to work because of that. So we have various mental illnesses, and each of them has various symptoms. We also have mental illnesses which are caused by general medical conditions. For example, somebody with cancer and then they get depression. Thyroid disease can give you anxiety, can give you depression, can give you psychosis. So we also have mental illnesses which are caused by general medical condition. Again, we have mental illnesses caused by use of substances, drugs of abuse. Commonest, cannabis is a lot. Alcohol is being used a lot in Kenya. So each disease, each disorder has various symptoms. So probably as we go on, we'll be able to see most of those disorders and discuss them further.
And the degree.
And the degree. Yes.
So Dr. is a parent, concerned parent here. She says, hi doctor, is it okay to warm child food with microwave? Can it cause cancer to the child?
I think we answered the question. It was very simple. And I want all the mothers who are outside there listening, use the microwaves without a problem. But we did mention on that day that the microwave does not heat the food uniformly. I think that's the biggest message. If you use a microwave, you may find the food in the middle is quite hot. The one on the sides is a bit cool. So ukijaribu, ukiweka mkono, if you're trying it out to see whether it's now ready for the baby to use, and you just touch the end, you may find by the time you reach the middle, it's so hot for the baby, and it will burn the baby's lining of the mouth. So apart from that, the microwaves are safe. How would you know that the microwaves cause cancer? In the ideal world, and he will tell you in the UK, when they wanted to know whether cigarette smoking causes cancer, they got a group of doctors who smoke and the other doesn't smoke. So you follow them up. It's called a cohort study. You follow them up and see how many of those develop cancer among those who don't smoke and the others who smoke. So that's the same thing with microwaves. We must get a number of children whose parents are using microwaves to warm their foods, and another group where we are not using microwaves, and then follow them up for a long time, possibly 20, 30 years, and find how many of those get cancer among those who are using microwaves and those who don't. It's just like the same question that came recently, and somebody said that if you use diapers, then these babies are not going to have babies in future. Again, you go to do the same kind of study. And we got a lot of phone calls, and many mothers wanted to stop using diapers. So that's not true. So microwave and cancer, if people are going to get scared of cancer, then as we said, what we call panic attacks, and people are going to panic on everything. They're going to find, you saw a few days ago about Coke, and somebody said, and somebody called me and said, my baby has been drinking Coke, they like it. So I think cancers are there. But one must know that there's a word in medical terms called multifactorial, meaning there are many factors that must come together to give cancer to this particular man and then the man in the neighborhood. It's not that everybody who smokes is going to get cancer, but the chances are that you could get it. So there are other things that come into play other than just a microwave. So for us to know whether microwave causes cancer will take us a very, very long time. But today, and I hope if somebody who has another type of information can let us know. But today you can use a microwave comfortably. Just make sure that chakula chatoka kule. Don't, because you remember that microwaves have timings. You can half a minute, 1 minute. So when it comes out, koroga, Ushakoroga, you got to ensure that the food is uniformly warm, and then hata ikiwa ni maziwa, koroga, then give it to the baby, but they are safe.
Okay.
I hope now Dorcas
so Dorcas knows. I mean, the solution here ni kwamba microwave is not bad, but lazima ukoroge vizuri kabisa. Sawa daktari. And what is the most common problem that people come in for?
Okay, generally in the outpatient, we see a lot of anxiety disorders, and I've mentioned that there are various types of anxiety disorders. We have the generalized anxiety disorder, where this particular person will keep worrying about most things in their life. Am I going to be sacked at my workplace? Is my baby going to be well? Is my husband going to leave me? They are worried about everything, almost everything about their life. That is what we call generalized anxiety. We also have phobias. There are people, for example, who will not get into a lift because they are scared that something will happen there. And again, that comes in together with panic attacks, where you find that this particular person, probably when they're in the lift, they get a panic attack. A panic attack is where you get your heart beating very fast, your blood pressure going high, and then you feel like you're dying, and you're so scared, and you feel like you're going to die. And these people say that at the moment they're having that attack, it is the most horrible feeling they have. So that is another form of anxiety disorder.
That's panic, because of panic.
Because of panic, yes. We also have what we call OCD, where, for example, a person may fear dirt so much to the extent that they have to go around wearing gloves. Every time they touch anything, they have to wash their hands. Obsessive compulsive disorder also, it's also a form of anxiety disorder. So that is very common, and it's more common in women. So again,
why is it and not men?
Yeah, probably is because of our again the genetic makeup, the hormonal makeup. But again, you see the factors which are likely to predispose one to get anxiety disorders is also more higher in women, because we realize that if somebody is able to control their life, for example, if you have enough investments such that tomorrow you don't have to worry what you're going to eat tomorrow, that reduces your anxiety. So again, we know that generally when you compare women and men, women are generally on the lower side in terms of income. So you discover that that could also contribute to the increased rates of anxiety, because they feel they are not able to control their life. Again, the way the society is, you see, most decisions will be done by the men, and women probably will just be informed. So like women will feel they have no control over their life, and they worry a lot.
Okay, it's been a pleasure having you, Daktaris. Coming to our studio is our greatest joy and happiness. And we also want to thank our partners out there. And because we are marking 5 years since Doctors on Call was initiated, thank you very much for your support, and thank you very much for all those people who haven't even taken the step. And we believe that by now, right now, you are going to take a step that we are going to keep Jesus on the airwaves. And thank you very much to members of our audience, from all of us in the studio. Thank you very much, and may you continue keeping Jesus on the airwaves and have a pleasant viewing.